around those other people that are using and getting high, and all of a sudden now you got a whole thing going on there. They're looking for connections. Who's telling you about selling weed? When a guy goes to jail, he comes out more of a criminal than when before he went in, because they learn more tricks.
Yes, ma'am.
One question about this new healthcare reform. Is there anything in there to help get funds or allocate resources for people suffering from mental health disorders and coexisting, co-occurring substance abuse disorders? I know that prevention is the cheapest thing to do and the most sensible in terms of public health, but is there any allocation in there? I know they're trying to push preventative medicine.
Yeah, it's a great question. Actually, in the bill that's actually been signed into law, there are provisions which are actually taken out of House Bill 225 that do that exact thing, which are to provide alternatives for people who have become addicted to getting into treatment. And again, this is my point in regard to these two bills that are currently going to be in existence together. It's very important to get out there exactly that. I took some notes today. Some of the things that are going to be taken out of this new House Bill 225 that are in the prescription drug monitoring program bill that currently exists. One would be oversight by the state, which would make recommendations for the implementation of the prescription drug monitoring, so it's in effect effective. Performance measures for public health issues, to alert the public when there are public safety issues in regard to substance abuse and prescription drug abuse, but also in measuring public health and directing those public health measures towards future policy to stop not only prescription drug abuse, but also the prescription drug diversion.
Yeah, I got something very interesting to say there. We talk about the opiates, we talk about that. Now people get off these opiates and all of a sudden, sometimes anxiety comes up, depression comes up. I don't know if people realize this, but when they have an addiction treatment program, if you tell the insurance company they have depression and anxiety and you're not medicating them, they tell them that they don't have to be there. Right, Jim? So that gets you both ends.
And directed to your question in regards to healthcare reform on the national level, that you answered that. The general diagnosis of the bill in terms of mental health and substance abuse is reported to be, I don't know the details, but most mental health and substance abuse specialists that have reviewed it are very favorable to its reforms, to expanding opportunities. And the other major issue with healthcare reform is just earlier this year was passed parity for insurance coverage for mental health and substance abuse services with physical health. So if a person has health insurance that covers mental health and substance abuse, it has to have full coverage. It's not perfect yet, but that's a major, almost 15-year-long process to get that.
Didn't the insurance company say that they're going to take that out of their policies?
But it limits, it removes the limitations that are on insurance company payment for mental health disorders.
Yeah, a lot of people don't know that, for example, until Cleary passed, that Medicare paid substantially less for mental health services. Like half.
And a lot of
limited people's access to care in a really unfair and discriminatory way. So this has been going on for years. It looked like the mental health parity was going to pass in 2001, right into September of 2001, when our country became understandably preoccupied with other issues.
Nice thing about parity, as a private practitioner in the mental health field, one of the issues that we always face was the limitations. That, one person that we saw had $1,000 lifetime coverage for addictions on their insurance. That was it.
Yeah, it's not clear how this is all going to fall out because there are still some loopholes for the insured. But at least they won't be able to go to, people that actually buy insurance are not you and the people that, actually benefit from insurance. It's companies. And so if somebody, you know, an insurance company goes to Nova Southeastern University, for example, and says, well, we've got great mental health coverage and, you know, you're providing a wonderful package, they're going to have trouble getting away with what they have done for a long time, which is offer very limited and lousy coverage.
Any other questions tonight? Yes, ma'am.
I'll volunteer myself to be the last one.
We'll start with you, we end with you, and then full circle.
Well, I don't know if there's data or maybe just anecdotal from your own experiences, because you all seem to do a little this, a little that, and deal with a lot of aspects of this problem. Is there enough to know if, say, preemptively, you say, okay, this person has a new injury or like some new onset of chronic pain, maybe prophylactically saying, well, they're probably going to